Good afternoon, everyone. I will be presenting my research on clinical and microbiological profile of microbial keratitis and its antibiotic sensitivity. Uh, Infectious keratitis is characterized by corneal epithelial disruption and inflammation resulting from bacteria, fungi, viruses, and parasites. It is also termed as a silent epidemic in resource-limited conditions. Risk factors include injury to corneal surface, prolonged application of topical steroids, conditions causing dry eye, incorrect use of contact lenses, inadequate eye hygiene, and underlying systemic diseases like diabetes mellitus hinders its healing. This study aimed to assess the incidence, associated risk factors, microbiological characteristics, and antibiotic susceptibility profile. This was a one-year prospective longitudinal study conducted at Department of Ophthalmology and Microbiology at GMC Amritsar. Included patients aged 25 to 75 years with signs and symptoms suggestive of corneal ulcer, patients with cognitive impairment, refusing informed consent, unwilling or unable to receive treatment, and previously treated corneal ulcers or any other anterior segment pathologies were excluded. A thorough history was documented for each patient, covering the onset and duration of visual symptoms, any history of trauma or precipitating factors, previous occurrences, systemic conditions, and prior antibiotic or steroid use, and any relevant allergic history was recorded. Every patient underwent a comprehensive ophthalmic assessment which included best corrected visual acuity, slit lamp biomicroscopy to evaluate the size, depth, margin, associated features such as hypopyon and stromal infiltration, examination of the posterior segment if possible, and B-scan ultrasonography. Corneal scrapings were obtained under topical anesthesia using 0.5% proparacaine, and scrapings were collected under slit lamp magnification from edge and base of ulcer using sterile number 15 surgical blade. Samples were immediately transported to the Department of Microbiology. Then the data was collected during the study were compiled and analyzed to evaluate the incidence risk factors, microbiological pattern, and antibiotic sensitivity profile. These are the few pictures on day of presentation. 118 patients were included in our study, with mostly patients belong to 45 to 64 age group. Approximately 50% belong to this age group. Majority of cases occurred in male, with a male to female ratio of 2.5:1, and rural population exhibited a higher prevalence of 75% as compared to urban residents. Farmers were mostly affected, 49%, with field workers making up to 19% and carpenters 5%. Housewives and other occupations constituted 26% of the age. Injury with vegetative matter was the most frequently observed risk factor in our study, with a percentage of 55%. Foreign body included 14%, and any other unknown cause included 29%. When noted while clinical presentation was with epithelial defect of less than 3 mm was noted in 31%, 3 to 6 mm in 61%, and more than 6 mm in 7% of the participants. Hypopyon was observed in 27% of participants. On microbiological analysis, 66 cases were positive on microscopic examination of corneal scrapings. 40 cases showed no detectable organisms. Fungal hyphae was observed in 59% of cases, gram-positive bacteria in 16%, and gram-negative bacteria in 9% of the cases. Mixed result was found in 15% of the corneal scrapings. Culture result was positive in 24 cases, with fungal growth observed in 13, while bacterial in 11 cases. Among fungal isolates, Fusarium constituted 69% and Aspergillus 23%. Among bacterial isolates, Staph aureus 45% was noted in 5 culture plates, and Pseudomonas, Staphylococcus epidermidis, and Streptococcus was noted in 18%. These are few bacterial. On basis of microbiological and clinical characteristics, final diagnosis was made. Fungal ulcer was identified in 45%, bacterial in 18%, and viral in 10% of the cases. Among 11 positive bacterial cultures, half of the samples were sensitive to cephalosporin, fluoroquinolones, beta-lactams, tobramycin, and erythromycin. Sensitivity to amikacin and linezolid was noted in 70 to 75% of cases, while 60% responded to tetracycline and vancomycin and imipenem or meropenem. Aztreonam, ampicillin, gentamicin showed sensitivity in only 25 to 37% of the samples. An increasing resistance trend was observed for ampicillin, gentamicin, tobramycin, and aztreonam. No resistance was identified for colistin and clindamycin. Discussion. Most affected age group was 45 to 64 years. Average age group constituted 51 plus minus 12.48 years. Male to female ratio was observed to be 2.5:1 and predominance of middle-aged rural males was
Kindly
noted.
summarize. Kindly summarize it.
So among fungal cases, Fusarium and Aspergillus was the most common fungi, and the bacteria Staph aureus was the main causative factors, and emerging resistance to aminoglycoside and beta-lactams was noted.
So any difference means you have done your antibiotic sensitivity in your region, most likely in Punjab. So have you compared that what is the antibiotic sensitivity done in the previous literature at other part of the India?
Sir, other parts also same resistance was also noted in some other studies also. So reference was taken.
Okay, thank you.